This is a download from BFM 89.9, the business station.
Welcome back to the Morning Run. I'm Roshan Kanesan with Noelle Lim and Lynn Mark in the studio this morning. Prime Minister Tan Sri Muhyiddin Yassin will chair a meeting later today to discuss the nationwide MCO.
Yeah, so de facto Law Minister Dr Sri Taqiyuddin Hassan said that the matter will be assessed and decided in the Covid-19 National Security Council in Putrajaya. He said a full-scale MCO is among measures to be considered by the council, and this will be discussed obviously before any decision is made.
Right. And of course, when we take a look at the situation, there are also the federal government views the spread of this very seriously. Of course, Malaysia has recorded 492,000 cases for COVID-19 as of yesterday, close to 500,000 positive cases. Taqiyuddin added that with the death toll at over 2,000, this is a great concern, but the government is also aware that the number of recoveries too have increased. However, currently around 50,000 people are still active or infectious, and it's already testing close to the limits of our healthcare system. So for more on this and the full-scale MCO, we're speaking with Dr Carmelo Ferlito, CEO for the Centre for Market Education. Carmelo, good morning and thank you for joining us. There have been, as I think we've all noted here, increased calls for full-scale MCO, especially in Selangor, because of the rising case numbers. But industry players are against it because of the damage it will do to the economy. What's your take on this? Are we at a point where a full MCO is necessary?
Good morning. And thanks for having me. Well, I think that this debate would have a meaning if MCO would work. So if somehow we had to sacrifice something on the economic side because MCO would spread, would break the chain of infections, then we could discuss that. But the worldwide, the success rate of MCO is 0%. So I wonder why we keep on discussing the possibility of a measure that produces a lot of harms and don't bring any benefit.
Now, Carmelo, I don't necessarily agree with you on that point because I've got the numbers in front of us here in terms of weekly averages, and each time we do put in a lockdown, the numbers do fall. So I don't know, where are you getting this analysis from? Why are you a proponent of the fact that this doesn't help?
Well, first of all, we have dozens of academic papers. And second, it's true that the lockdown can temporarily put a halt on the spread, but it is like a lid on a boiling pot. The moment in which you must, because you can't keep the country on a lockdown forever, the moment in which you lift up the lid, then the situation is worse than it was before, and therefore cases grow at a faster pace than were growing before, for several reasons, because of a weaker immune system that you produce because you keep the people at home, because the people are stressed by the fact of being at home and therefore becomes less SOPs compliance. So it is just a way to delay the problem, but it is not a way to solve and to address the problem.
Right. So you're not necessarily, don't necessarily think that it doesn't help at all. But the fact is that the cases do come back up after the fact. And but when we take a look at the situation, of course, there's economic damage there. What's, I guess, a more sustainable alternative then to address the current situation? Because we have to deal with this. The numbers are rising.
Absolutely, I agree with you. So I'm not advocating that we should do nothing. This is not my point of view. We should do something differently. So first of all, we are, of course, facing an healthcare emergency. And the first thing we should do is to invest in strengthening the healthcare system. So we keep on hearing that our ICU units, our hospital beds are at collapse point. But what have we done in the past 15 months to avoid to reach that point? So we have wasted time. And again, to allow temporary MCOs without an additional strategy, which is investing in a healthcare system, it would be completely useless, will be wasting time. Another strategy that I would implement would be mass and frequent testing. So this is a bit different from only the concept of mass testing. So it doesn't mean only testing a lot of people, but means testing possibly everybody every week. So it means allowing businesses and schools to operate and discuss with businesses and schools to have everybody tested every week so that you can detect cases at the early stage and treat them before they become heavy cases and avoid asymptomatic spreads by isolating the people that are tested positive immediately at a very early stage. And third is a better collection of data. Now we only have data about where the cases are arising, but we don't have the relationship of this data with the number of tests. So, in example, if we do 70% of tests in workplaces and we get that 70% of cases are at workplaces, that is nothing wrong. It's consistent with the number of tests that we do. Secondly, we need to address data about the people that are dying or developing heavy symptoms. So the age, race, gender, and medical conditions. This will allow us to develop a better targeted approach, and finally protect these categories that are more at risk by isolating them, and instead allow those people that are stronger to eventually get infected and develop immunity.
So the train has basically left the station, and now we're stuck with about, maybe today 7,000 cases a day, right? So the cases are really high. So in the short term, almost like in the next month, it's quite crucial. Then wouldn't you say a full MCO might still be needed, plus the measures that you just mentioned?
I think that if we implement the measure that I advocate, probably the MCO would not be necessary, or we can leave the MCO as it is now by just strengthening some of the SOPs, because I'm strongly convinced that keeping, even for another short period, people at home is going to be bad for the people in terms of a physical and mental resistance, and opening the doors even to more serious disease.
Even now, in the current situation, there are also calls for banks to re-implement full moratoriums on all borrowers for 3 months to reduce the economic impact, both on individuals as well as organizations. Is this necessary?
It may be necessary to do something if we keep going ahead with this lack of strategy, but I'm also concerned on another factor, is that we have in this moment a deep dichotomy between the real economy and the monetary economy. So the real economy is suffering without any doubt, but on the other side, because of the measures that have been implemented from the fiscal and monetary perspective, we have an excess of liquidity in the system. And this dichotomy, sooner or later, is going to create problems. So I would advocate for a situation that doesn't force us to go again into the loan moratorium.
On the flip side there, Carmelo, what kind of support measures do you think will be needed in any kind of situation, especially given, let's say we don't even go into a full-scale MCO. Mm-hmm. The economy is currently hurting. There are people who have lost incomes. What kind of support measures do you think are most suitable here, especially since earlier this year we had a rather optimistic tone with regards to the economy?
Yeah, absolutely. I think that kind of projections that I label them as unrealistic at the end of last year, and they become all the more unrealistic now. So I think that 7% is really impossible to be achieved. I think that the government should implement now a task force that address not only the medical situation but also the economic situations. See where are the situations of higher degree of suffering and develop targeted measures, knowing that the best strategy is a strategy for growth. Now we have a situation of political uncertainty and total discoordination on the COVID strategy that is depressing the economy and impeding every kind of recovery, and even forcing some businesses not only to close or eventually the big business to relocate. So if we don't think about this strategy, then every kind of support measure would be just a little patch on a big hole.
Carmelo, thank you so much for your time this morning. Very insightful. And that was Dr. Carmelo Ferlito, CEO for the Center for Market Education. We're running a poll on Twitter right now on this very topic. Would you support a stricter full-scale MCO? 51% have said yes to stop the spread. 30% say it depends on government assistance. 15% say no, it's too bad for the economy. And 3.5% say it's not sure. Very quickly, Noelle, what are your thoughts on this?
Yeah, I think if we had time, I would really love to explore the topic of vaccination, because so much hinges on that, right? The faster we vaccinate people, the better, right, it is. So about 13% of registered participants have been vaccinated so far since February. I'm wondering whether we could, really bump up that pace.
Right, and that's you can get in touch with us over on Twitter at BFM Radio and let us know your thoughts there. We'll keep it here to BFM 89.9.
Thank you for listening to this podcast. To find more great interviews, go to bfm.my or find us on iTunes. BFM 89.9, the business station.